If you're considering testosterone replacement therapy, choosing the right provider just isn't important, it's essential. Here's a quick checklist to make sure you're in the right hands. 1. Make sure they do proper labs, and all of them. You need more than just a total testosterone. A full diagnostic panel should include total testosterone, sex hormone binding globulin, luteinizing hormone, CBC or complete blood count, prostate specific antigen, and then you can calculate your free testosterone. If a provider isn't running all of these or doesn't know why each one matters, that's a red flag. If your provider just wants to start you on testosterone replacement therapy and has not checked luteinizing hormone, frankly, you should just get up and run. That's literally the only way you can tell why your testosterone is low. This lab is the most important for answering the question of, are you going to be on TRT for life? And also, what would it look like if you were to come off TRT? The second thing is access to your healthcare team. You should have real access, not a call center, not a chat bot, and not someone new every time you reach out. You deserve a provider who knows you, your labs, your symptoms, your history. But most importantly, they should know your goals. Because this isn't about just adjusting a hormone level. It's about helping you perform at your peak, at work, at home, and in the gym. When you reach out with a concern, you shouldn't have to reintroduce yourself. You should be met with someone who already understands where you've been, where you're going, and what it's going to take to get you there. That kind of continuity isn't a luxury. It's the standard in high quality care. The third point on our checklist is ongoing monitoring. TRT isn't a one and done. Hormones are dynamic. They shift based off stress, sleep, training, and even your diet. If your provider is only checking your labs once a year, they're not monitoring your health. They're guessing. You need consistent follow-up. Not just blood work, but structured symptom tracking and personalized adjustments. Because optimizing hormones is a process, and that process demands precision, not autopilot. The fourth point on your checklist should be transparent pricing. No nickel and diming. Look for clear upfront pricing. Some clinics, they advertise a low monthly fee, but once you're in, the real costs start stacking up. Labs, extra. Medications, extra. A simple follow-up call, you got to bill that separately. That's not healthcare. That's a bait and switch model. A trustworthy clinic should be transparent about the cost from day one, with no hidden fees, no surprises. You deserve to know exactly what you're paying for and what you're going to get in return. Because when it comes to your health, clarity is a non-negotiable. The fifth thing on your checklist should be your provider should be a specialist, not a generalist. This is your health, your hormones, your performance. You don't just want someone that includes TRT in their services. You want someone who lives and breathes hormone optimization. There's a big difference between a provider who dabbles in testosterone therapy and one who specializes in it. Hormone balance can be complex. It requires a deep understanding of physiology, feedback loops, lab interpretation, and patient outcomes over time. So ask yourself, is your provider an expert in hormone health, or just adding it on to their primary practice? When it comes to something as important as this, you don't want a generalist, you want precision. And here's the final thought. TRT is more nuanced than most people realize. It's not about chasing a number, it's about optimizing an entire system. Your energy, your resilience, your performance. That starts with a provider who looks beyond the labs and understands why they are the way they are. Someone who's not just treating your testosterone, but someone who's helping you function at your best, mentally, physically, and emotionally. If you want to take the first step, you can download our free ebook. It walks you through the exact labs that you need before starting TRT and why each one actually matters. Even better, if you've already gotten your labs, schedule a free 15-minute discovery call. We'll review your results and help you understand what's next. No pressure, just real guidance. If you're serious about optimizing your health, start there. Start with the right labs, and we'll walk you through the rest.